Cardamom is often called the queen of spices. But beyond the aroma, what does science actually say? Today we will break down the real health benefits of cardamom in the human body. What the strongest clinical studies support. What is exaggerated? How much is effective? And how to use it in ways that actually preserve its bioactive compounds. Stay with me to the end because most people use cardamom in the least effective way. Let us start with what cardamom actually contains. Green cardamom Elateria cardamomum is rich in volatile oils. The most important compounds are 1,8-cineol, also called eucalyptol, alpha-terpinyl acetate, limonene, and linalool. It also contains flavonoids, phenolic acids, and small amounts of minerals like magnesium and potassium. These compounds are responsible for most of the observed health effects. Now let us talk about benefits that are supported by strong human evidence. First, blood pressure and cardiovascular health. One of the most cited clinical trials was published in the Indian Journal of Biochemistry and Biophysics. In this study, adults with newly diagnosed hypertension were given 3 grams of powdered green cardamom daily for 12 weeks. The result was a significant reduction in systolic and diastolic blood pressure. Antioxidant status improved. Fibrinolytic activity increased, meaning better blood flow and reduced clot risk. This is one of the strongest human trials on cardamom. Second, antioxidant and anti-inflammatory effects. Multiple randomized controlled trials and systematic reviews show that cardamom supplementation increases total antioxidant capacity and reduces markers like C-reactive protein. This is relevant for metabolic syndrome, chronic inflammation, and cardiovascular risk. A 2020 randomized controlled trial in patients with metabolic syndrome showed reduced inflammatory markers and improved lipid profiles with cardamom supplementation. Third, digestive health. Cardamom has consistent evidence for improving gastric motility, reducing bloating, and easing indigestion. Its volatile oils stimulate digestive enzymes and bile flow. Human studies support its use in functional dyspepsia and mild gastrointestinal discomfort. Fourth, metabolic health and insulin sensitivity. Evidence here is moderate but promising. Clinical trials suggest cardamom may improve insulin sensitivity and reduce fasting blood glucose in people with metabolic syndrome. The effect is supportive, not a replacement for medical therapy. Now let us address popular claims that are overstated or not well supported. Cardamom does not detox your liver in the way social media claims. There is no strong human evidence that it flushes toxins. Cardamom is not a fat-burning spice. It does not directly cause weight loss. Any weight changes seen in studies are secondary to improved metabolic markers. Cardamom does not cure infections or cancer. While it has antimicrobial and anti-cancer effects in lab studies, these do not translate into clinical cures. Now let us talk dosage based on human evidence and meta-analyses. Most clinical benefits are seen at doses between 1.5 to 3 grams of whole or powdered green cardamom per day. For extracts standardized to polyphenol or volatile oils, doses between 600 to 1,200 milligrams per day are commonly used in trials. There is currently no large-scale meta-analysis solely on cardamom, but dosing consistency across randomized trials gives us confidence in this range. Let us translate those doses into practical kitchen equivalents. 3 grams of cardamom powder equals about 1 level teaspoon. That is roughly 6 to 8 green cardamom pods, crushed. 600 milligrams of aged cardamom extract is usually 1 capsule depending on standardization. Always check the label. Now let us compare forms of consumption and what is gained or lost. Raw crushed cardamom pods offer the highest volatile oil content. This is the most potent form for digestion and antioxidant effects. The downside is variability in dose. Cardamom powder is convenient but loses volatile oils quickly once ground. Potency drops significantly within weeks unless stored airtight and away from heat. Aged cardamom extract provides consistent dosing and better shelf stability. However, some heat-sensitive volatile oils may be reduced during processing depending on extraction method. Cooked cardamom loses a portion of its volatile oils, especially cineol. What remains are more stable polyphenol. This makes cooked cardamom milder but still beneficial. Now let us talk about bioavailability. Crushing the pods just before use improves absorption. Consuming cardamom with healthy fats enhances uptake of fat-soluble compounds. Warm liquids improve volatile oil release. Gut health also matters. Poor digestion reduces absorption of polyphenol. Synergistic foods and nutrients. Cardamom works well with black pepper due to piperine, which enhances bioavailability. Ginger enhances digestive effects. Healthy fats like coconut oil or olive oil improve compound absorption. Potential pharmaceutical interactions you must know. Cardamom may enhance the effects of blood pressure medications. It may interact with anticoagulants by mildly increasing fibrinolytic activity. Caution is advised with sedatives due to mild calming effects. Always consult a clinician if you are on chronic medication. Side effects and populations who should be cautious. High doses may cause gastric irritation in sensitive individuals. People with gallstones should use caution due to bile-stimulating effects. Pregnant women should stick to culinary amounts. Ways to prepare cardamom for daily use. Crush pods into warm tea. Add to cooking near the end to preserve aroma. Blend into smoothies with healthy fats. Use standardized supplements for clinical dosing. What to look for in supplements. Look for botanical name Elateria cardamomum. Avoid vague labels like cardamom blend. Check for standardized extract percentages. Choose products with third-party testing and proper storage packaging. Let us conclude. Cardamom is not a miracle spice. But it is one of the most evidence-supported culinary herbs for blood pressure, digestion, antioxidant defense, and metabolic support when used correctly. Used casually it is pleasant. Used intentionally it is powerful. If you found this breakdown helpful, like this video. Subscribe for evidence-based nutrition and clinical insights. Follow the channel for more deep dives. Share this with someone who loves spices but wants real science.